All right. Welcome to the Conscious Resistance Network. My name is Derrick Broze, and today we are going to be showing you how the health officials, the governments, they are prepared and preparing for how to convince you to take the COVID-19 vaccine. We're going to get into that and so much more, guys. I've got about 7 or 8 links to go over. This is all going to be very vital, important information that you need to know in what we are dealing with, what I have termed the vaccine. Well, I don't want to take credit for it. It was actually the first place I heard it was the New York Times. But what the New York Times, the mainstream, and others are calling a vaccine information war. And make no doubt about it, we are in an information war, but we have seemed to have switched gears now and moved into the vaccine information war. This is what the mainstream is calling it, as they are preparing and coming up with new ways how to convince you and your family to take the vaccine, to not worry about the potential for harm, to not worry about the fact that the companies making the vaccines have indemnity and will be protected from any sort of wrongdoing if you're injured. They don't want you to worry about those things. Instead, the goal is, how do we convince the public that this is all okay and that everything is just fine? We're going to talk about that and so much more. But first, I want to remind you guys to bookmark my website, theconsciousresistance.com, which is the home for all of my content. This is where you can find and download all of my books for free. You can you can watch and for free all of our documentaries. You can find podcasts and so much more. Also, guys, we have this music submission tab. I kind of forgot about this. And the other day I realized I have an inbox full of music submissions from like the past year. So thank you to everybody who sends me music submissions. I will be playing these as part of Freethinker Radio. And maybe even we'll just do like a music hour or something sometime so we can share conscious music of all kinds. But be sure to bookmark theconsciousresistance.com. Follow us on all of our alternative social media platforms. I just went over this video in the video before about how important it is to sign up for our email newsletter. Right here, you can sign up and to follow us elsewhere, because we likely will be deleted soon. I'm not saying that because I want to. I'm just accepting the current paradigm and the current environment and how likely that might be. So you want to follow us before we disappear. And as I mentioned, we are in the middle of a vaccine information war. I wrote this article for The Last American Vagabond back in May. Which side of the vaccine information war are you on? Again, the New York Times put out an article called "Get Ready for a Vaccine Information War." And then after that, we had an article from Forbes magazine saying it's going to get ugly. The fight for COVID-19 vaccine is going to get ugly. They're preparing us for this thought that, people are going to push back. And it's because they're accepting the reality. I mean, the reality is that there are so many people, and I'm sure you guys have seen it, so many people who are at the very least skeptical of the vaccine. And these are people who are self-identified pro-vaxxers who say that because of the rush nature of the vaccine, because of the admitted already high levels of adverse reactions, that they are not likely to take it. According to 2 different polls, we had 33% of people saying they wouldn't take the vaccine and as high as 51% people saying they wouldn't take a vaccine. So that's a problem for people like Bill Gates and others who say we need 70 to 80% of the people to take the vaccine, or Bill Gates who said we need to vaccinate 7 billion people on the planet. So how do you do that? How do you think about this in a way that is scientific? And if you know anything about these people, you know that they are scientific in the way they operated. They didn't just randomly think of Event 201 and study the situation just for their own, just to have some fun. They did so because they want to understand how humans will respond, because they study our psychology. This is what the Predator class does. The New England Journal of Medicine released this study June 26, 2020, guys, so just a little bit over a month ago. And it's called Perspective, Ensuring Uptake of Vaccines Against SARS-CoV-2. We're going to go over this and another recent story that some of you may have heard about. I don't think many people saw this one. But what I think is incredibly important about this study is that it outlines 6 substantive criteria that should be met before a state imposes a SARS-CoV-2 vaccine mandate. So they're basically outlining that if you're a government and you plan to impose a vaccine mandate for coronavirus, you should follow these 6 steps. So the first is the existence of evidence that COVID-19 is inadequately controlled in the state by other measures such as contact tracing, testing, isolation, and quarantine, and as indicated by sustained troubling trends in new cases, hospitalizations, or deaths. So I kind of think that's interesting. They're basically saying, like, if it's out of control and testing, contact tracing, isolation, and quarantine aren't working, and if you have new cases, hospitalizations, or deaths. So they're meeting all criteria. Maybe if you got a lot of deaths, then it's out of control. If you got a lot of hospitalizations, it's out of control. If you got new cases, it's out of control. But as my longtime listeners will know, there's definitely problems with the way that they're measuring cases, the tests themselves. And so that's already, I think, a problematic criteria from the beginning. It says principles of public health law and ethics require that interventions that impinge on autonomy be reasonable and necessary. Therefore, COVID-19 must present an ongoing threat. By the time a vaccine is available, more will be known about natural immunity in the population, the consequences of relaxing community mitigation measures, and the feasibility of scaling up test and trace strategies. There should be a reasonable indication as to whether further measures are needed. So I'm just going to go ahead and read their 6 criteria. We're going to spend a few moments on this, and then we're going to get into another important study. But again, this is coming from the New England Journal of Medicine, ensuring uptakes of vaccines against SARS-CoV-2. And they're calling for 6 criteria that a state should follow in order for them to issue a mandate. And the first one, I think, is just kind of establishing that they want the public, whether real or imagined, to be told that that it's not adequately contained, that they have been unable to contain COVID or whatever the situation may be. And thus, we need to proceed to the next step. The next step is the Advisory Committee on Immunization Practices has recommended vaccination for the groups for which a mandate is being considered. So in that case, what they're talking about here is that the second criteria is that the Advisory Committee on Immunization Practices, which I've never heard of, after reviewing the safety and efficacy evidence, has recommended vaccination for persons who would be covered by a mandate. Currently available evidence suggests that elderly health professionals working in high-risk situations or working with high-risk patients and persons with certain underlying medical conditions should be or may be a high priority for the group's consideration. And persons with blah, blah. So it's basically saying that once this group, the Advisory Committee on Immunization Practices, has issued the recommendation, then as a vaccine nears approval, they should review it and then provide updated evidence and update recommendations. And only the recommended groups should be considered for a vaccine mandate, though health officials encourage voluntary uptake using means such as public education campaigns and free vaccines. So the second criteria, they're saying that the state should mandate it after this group reviews the vaccines and the evidence and makes a recommendation and says, hey, we believe this group of people, young people, old people, black people, white people, whatever, need to get a vaccine. And then this, according to this paper, it would then be justified for the government to issue a mandate based on that advisory. Obviously, I don't agree with that. I don't even know who the heck the Advisory Committee on Immunization Practices is. I definitely never voted for them. I doubt anybody has heard of them. The average person has heard of them. And so I know they didn't vote for them to give them the ability to make these decisions. Some would argue, no, we vote for the people, and then the people listen to the experts, and the experts are the Advisory Committee on Immunization Practices. But offhand, I would say, we should be skeptical of who they are and what their purposes are. And even if you thought that they were the most kind, most intelligent people in the Advisory Committee on Immunization Practices, I still would not support there being some sort of forced mandate. Let them make a recommendation. That's fine. And the people who give it weight will do what they say. And the people who don't think it's worth, 2 shits will ignore it. But we don't need the government to be enforcing it. Their third criteria says the supply of vaccine is sufficient to cover the population's groups for which a mandate is being considered. So if you have sufficient vaccines to cover whatever recommendations they make, then, go ahead and do it. Available. And so the other criteria is that the available evidence about the safety and the efficacy of the vaccine has been transparently communicated. So that's their fourth step. If you tell the people what, what their, potential harm is, then I guess you're good. So that's what they say here is there's been transparent communication of the best available evidence of the safety and efficacy, particularly given the possibility that the evidence underlying the FDA approval of SARS-CoV vaccines may be more modest than usual. That's a nice way of saying they might not take as much time or do as much research as they typically would do in a normal vaccine trial. And considering that, policymakers and the public will need to understand the limits of what is known. Public's trust has already been compromised by federal officials' endorsement of hydroxychloroquine, which, by the way, studies are finding is effective, and other studies say it's not effective, but it's just funny how they throw that in there. I'm sure this is not political at all. The fifth criteria, the state has created infrastructure to provide access to vaccination without financial or logistic barriers compensation to workers who have adverse effects from a required vaccine, and real-time surveillance of vaccine side effects. Now, this is really interesting. So, provide support mechanisms for people who are required to take the vaccine. Lessons from past vaccine campaigns suggest that a generous compensation program for people who have serious vaccine side effects should be a centerpiece of these efforts. A federal compensation fund like the Smallpox Vaccine Injury Compensation Program is one attractive model, although identifying compensable injuries may be challenging with a novel vaccine. States will also have to create distribution systems to provide the vaccine to high priority groups with near zero financial and logistical barriers. For example, bringing free vaccines to points of care, pharmacy, and work sites. And guys, I covered this in my recent video, Don't Tell the Anti-Vaxxers About This Study, how there's an increased effort to use community programs and to get into churches and to get into the places that people trust and to give away masks for free and to give away vaccines for free. That's how they think they can build trust within communities and get people to submit. Equally critical is to have a safety assessment plan in place before vaccines are widely distributed. So look, that's 2 times in this document in this New England Journal of Medicine where they admit that there are potential for vaccines and that people need to be made aware of that, and maybe people need to be compensated for that. The final criteria says, in a time-limited evaluation, voluntary uptake of the vaccine among high-priority groups has fallen short of the level required to prevent epidemic spread. So what that means is that if people are not voluntarily taking it after a certain amount of time and there's a spike, then they basically need to make it enforceable. So it says the last criteria is the vaccine mandates are imposed only after a time-limited trial of a voluntary vaccine provision has proved unsuccessful. Guys, this is what they're going to do. They're going to say first people are going to be rushing. Your mom, your grandma, your neighbor, they're all going to be rushing to go get this vaccine. Some people are going to get injured probably, and they'll downplay that or call it crazy conspiracy, or we'll all just be off YouTube and Facebook and won't be able to tell anybody about it. And then once a certain amount of time passes, they're going to say, here comes another spike. Despite the vaccine, the 1s and the 2s and the 3rd dose, it's not doing anything. You know why? Because your neighbor is not getting the vaccine. So enough time has passed, and now we must go beyond voluntary vaccine provisions. Principles of public health ethics support trying less burdensome policies before moving to more burdensome ones whenever possible. In this case, the cost of a failed voluntary scheme are sufficiently high that the attempt should be limited to a matter of weeks. States should implement a system for measuring vaccine uptake within each high priority group against a set of coverage targets. So basically, follow a certain high priority group, set targets, and see if you meet them. If you don't meet them, after doing the economic and logistic supports, making them free, getting out into the community, well, then it might be time to mandate it. And right here they write, if the proposed trigger criteria were met, what might a vaccination mandate look like? Because the constitutional power to protect public health rests primarily with the state, each state will need to adopt its own legislation. Proposed legislation should be supported by attestations from the state health officer, the ACIP, or another expert committee that all trigger criteria have been met. Targeted SARS-CoV-2 vaccine mandate policies may also be appropriate in certain federal contexts, including high-risk groups in active duty military environments, veterans affairs facilities, federal prisons, and immigration detention centers. Although state vaccine mandates are usually tied to school and daycare entry, that approach is not appropriate for SARS-CoV-2 because children won't be a high priority group, they claim right here. In addition, state mandates should not be structured as compulsory vaccination. Instead, so this is funny. It says it should not be structured as compulsory absolute requirements. Instead, non-compliance should incur a penalty. Nevertheless, because of the infectiousness and dangerousness of the virus, relatively substantive penalties could be justified, including employment suspension or stay-at-home orders for persons in designated high-priority groups who refuse vaccines. Do you guys hear this? This is not a freaking conspiracy. This is published in the New England Journal of Medicine, saying that if these different criteria are reached, that not only should you be penalized, which, I mean, that's basically the same thing as a compulsory vaccine, because if they penalize you $250 a day or something like that, and you can't afford that, well, you're going to submit. So it's social engineering. They might not be saying you have to do it, but they're basically, putting you between a rock and a hard place and an even harder place, and people feel like they have no options. But then you go on even further, and they suggest suspending people from employment and stay-at-home orders for persons in designated high-priority groups if you refuse it. And it says neither fines nor criminal penalties should be used, however. Fines disadvantage the poor, and criminal penalties invite challenges on procedural due process grounds. And see, that's interesting. They're like, well, we don't want to do penalties because then people might challenge this in court and challenge whether we have the due process, whether they've been given due process to do this, whether it's constitutional. And we don't want that to happen. Both are bad public health policy for COVID-19 because they may stroke distrust without improving uptake. So yeah, this study, I will link this to you guys below. Actually, it's already been linked. If you go to theconsciousresistance.com, all the links are already posted on the front page of the website. You can see that. But has anybody seen that one? I will just link it in the video for everybody. Have you guys heard of this one prior? I know that there's another one going around right now that is been from Yale that some of you have seen, but that one I have seen less people talking about. I haven't seen anybody really speaking on that. But yeah, I mean, think about this. They're saying that they can suspend you from your work, or that the suggestion from these scientists in the New England Journal of Medicine is that they should suspend you from work, that they should keep you from going to school. Don't do fines or penalties because that'll create distrust. And maybe we're going to get a legal challenge that we can't beat. But I mean, the point is that this is the direction we're going, guys. This is how, as the video is titled, how they're going to convince you to take the COVID-19 vaccine. They're trying to study it. They're trying to figure out, okay, here's the 6 criteria. But let's go to the next story now as we start to wrap this up. Thank you again, guys, for everybody who's tuned in. This is Derrick Broze of the Conscious Resistance Network. If you haven't yet, please do hit the like button, subscribe, thumbs up, follow, all that good stuff. And make sure you guys can keep up with our content. Subscribe to our newsletter for sure. This one right here is on clinicaltrials.gov from the NIH, the U.S. National Library of Medicine. And it was sponsored by Yale University. And I think it came out, let me see if I got a date here. First posted July 7th, last update July 21st. And it is a completed study. COVID-19 vaccine messaging, part 1. Brief summary. This study tests different messaging about vaccinating against COVID-19 once the vaccine becomes available. Participants are randomized 1 of 12 arms with 1 control arm and one baseline arm. We will compare the reported willingness to get a COVID-19 vaccine at 3 and 6 months of it becoming available between the 10 intervention arms to the 2 control arms. Study participants are recruited online by Lucid, which matches census-based sampling and online recruitment. So they go on here and they describe the different types of messaging that they're trying to give people, and you can see they have different names for them. Like this one's control message So the control message is that a passage on the costs and benefits of bird feeding. Baseline message. It says a message about the effectiveness and safety of vaccine. Personal freedom message. It's a message about how COVID-19 is limiting people's personal freedom, and by working together to get enough people vaccinated, society can preserve its personal freedom. Isn't that funny how they're like actually trying to use health freedom, medical freedom as a way to convince people to get the vaccine? They're saying like, hey, COVID-19 is very limiting to our freedoms. We can't go outside. They want to shut this down. So you know what? Maybe if we go ahead and just get this vaccine, we can preserve that freedom. I have seen some libertarians argue that, interestingly enough. Economic freedom, which is a message about how COVID-19 is limiting people's economic freedom. And by working together to get enough people vaccinated, society can preserve its economic freedom. Self-interest message is a message that COVID-19 presents a real danger to one's health, and even if one is young and healthy, getting vaccinated against COVID-19 is the best way to prevent oneself from getting sick. Community interest message says that it talks about the health of loved ones, and said the more people who get vaccinated, the lower the risk the one is to the one's loved ones who will get sick. Society must work together and all get vaccinated. Economic benefit message is a message about how COVID-19 is wreaking havoc on the economy, and the only way to strengthen the economy is to work together. Guilt message. Here we go. Bring in the guilt. It's about the danger of the COVID-19 presents to health of one's family. The best way to protect them is getting vaccinated, and society must work together to get people vaccinated. Then it asks the participant to imagine the guilt they will feel if they don't get vaccinated and spread the disease. Think about that, guys. Think about how guilty you're going to feel. Embarrassment message. The best message, it says, is that the danger to COVID-19 presents to one's family and community. The best way to protect them is by getting vaccinated and making sure that enough people get vaccinated. Then it asks participants to imagine the embarrassment they will feel if they don't get vaccinated and spread the message. Are you embarrassed yet? Anger message, and it basically says, again, same sort of setup, and then it asks the participant to imagine that what they will feel, the anger they will feel if they don't get vaccinated and spread the disease. Are you mad yet? Are you freaking mad? Trust in science message. The message is about how getting vaccinated against COVID-19 is the most effective way of protecting one's community. Vaccination is backed by science, after all, and if one doesn't get vaccinated, that means one doesn't understand how infections are spread, or one who ignores science. Ha, anti-science denier. Not bravery message. This is message which describes how firefighters, doctors, and frontline medical workers are brave. And those who choose not to get vaccinated against COVID-19, they're not brave. Not like those great medical work. I mean, guys, this is pretty crazy. Wow. So this is funded by Yale. All right. This is a funded by Yale. So they want to embarrass you. They want to tell you you're not brave, tell you you're an anti-science denier. They want you to imagine the anger, the embarrassment, the guilt that you will feel. I mean, this is all collectivism. This is all about trying to get people, again, to shame individuals and to make people think that, thinking for yourself is a problem. And instead, you got to think about the greater collective. So let's look at the final conclusions here of this study and see what they came to find. Outcome measures, primary outcome measures. And number one, intention to get COVID-19 vaccine. This is a self-reported measure immediately after the intervention message of the likelihood of getting a COVID-19 vaccination within 3 to 6 months. During analysis, responses among those assigned to different intervention messages will be compared to those in the control group. Vaccine confidence scale, the persuade others item, fear of those who have not been vaccinated, social judgment of those who do not vaccinate. So they're talking about, basically measuring whether or not you're likely to shame somebody else, whether or not you're to trust them. I found this article from Collective Evolution, kind of going over some of the results. I'll include that as well. But this is the point, guys, is that they're basically like talking about shaming people. They're talking about trying to make you feel guilty, and they want you to imagine the guilt, the anger, the embarrassment that you'll feel if you don't take the vaccine. And we just covered the previous study from the New England Journal of Medicine, 6 different things, criteria that they think need to be met before a mandatory vaccination thing happens. And here's another study talking about the messaging. How can we convince people that it's safe? You can shame them. You can call them anti-science. You can do things of that sort. And they wonder why people are asking questions and why people are concerned. Could it be things like this? Recently announced that the vaccine distribution will be joint venture between the CDC and the Pentagon, aka the Department of Defense, aka formerly known as the Department of War, aka the people who bomb and kill people all around the world, the military. They're going to partner with the CDC, these 2 agencies that we can trust, to distribute vaccines all around the country as part of Operation Warp Speed. Those of you who still have faith in Trump, I think you need to rethink that very quickly as this situation accelerates forward. Now, as we segue from the main story, which we just covered 2 studies, one from the New England Journal of Medicine, one that's posted on the National Library of Medicine from Yale University, both of these discussing requirements and messaging and how to convince people and what are the steps we need to take before we initiate a mandatory vaccination. And none of these things acknowledge in any realistic way why people are asking questions. Guys, when I ran for mayor of Houston last year, 2019, one of the things I realized is that even if you're just asking questions about vaccines, you get labeled anti-vaxxer. And I've never had anybody clearly define to me what this anti-vaxxer term is, because there's people like myself who believe in bodily autonomy and freedom of choice and medical and health freedom. And there are people who are against all vaccines. There are people who want to change the vaccine schedule. There are people who are for vaccines but just believe in choice. And all of those people get lumped in as anti-vaxxers for asking these kinds of questions. So it's just a smear term, just like conspiracy theorists and all these others are. But when I was running for mayor, I realized that we're already in a dangerous place. This is well before COVID-19. I realized that even when I just told people, hey, I think that, people own their body and that you shouldn't be able to force them to take a vaccine if you think they need it, you shouldn't be able to force. The government shouldn't be able to use that force on them. Because all I said as a mayoral candidate was, I will never enforce in the city of Houston, that we're going to have vaccines. I wasn't trying to win. It was more to try to get the message out there. And people were pushing back already then pre-COVID. And now here we are in the COVID days. And you better believe people are for mandatory vaccinations. And now we have the military getting ready to start distributing this with the CDC. I don't know if that means they're going to come into your house, the military is going to round you up and force a a vaccine on you. I know that's the image that pops in people's heads sometimes, but I do know that that is, people talk about optics. That's not good optics to have the military running around there with the CDC helping distribute this. And this is absolutely psychological warfare. This is them trying to induce trauma-based mind control on us by constantly having people in a state of fear and anxiety. But let's just look for 2 seconds at one example of why people are concerned about this vaccine. Is it crazy to worry about the safety of this vaccine when we have reports like this just 5 days ago? AstraZeneca, one of the vaccine companies, to be exempt from coronavirus vaccine liability claim in most countries. AstraZeneca has been granted protection from future product liability claims related to its COVID-19 vaccine, hopeful by most of countries with which it has struck supply agreements, a senior executive told Reuters. With 25 companies testing their vaccine candidates on humans and getting ready to immunize hundreds of millions of people once the products are shown to work, the question of who pays for any claims for damages in case of side effects has been a tricky point in supply negotiations. That's all it is, guys. The health of your family and your kids and your friends, it's just a tricky point in supply negotiations. It's not really like, hey, people are going to get hurt. People could get injured. People might die. This is just a tricky point in supply negotiations. But Ruud Dauber, a member of AstraZeneca's senior executive team, told Reuters, quote, "This is a unique situation where we as a company simply cannot take the risk if in 4 years the vaccine is showing side effects. In the contracts we have in place, we're asking for indemnification. For most countries, it is acceptable to take that risk on their shoulders because it is in the national interest." He would not name which countries he was talking about. Now, indemnity, you guys might have heard this term in recent months, to indemnify. It's basically just giving these companies immunity. We can go back as far as April, and it was being reported then, Big Pharma throws out old models in the race to the COVID-19 vaccine. And I'll just show you right here. Indemnify. First, do no harm. How companies indemnify themselves against potential claims of harm from any novel vaccine might be a new consideration for pharma. And so they're talking about this way back then. And then we have this clip here from Bill Gates back in April, where he also says that the companies need to be indemnified, that they need to be protected against potential claims against them. So think about that. They're rushing this vaccine at a speed before we've never seen. It's called Operation Warp Speed. You've got people like Bill Gates and all these other folks involved. Companies like AstraZeneca and other corporations are applying for indemnity. And Bill Gates here is saying, yes, these companies need to be protected. Check this out real quick. So in that long little word salad he just said there is some risk and need for indemnification. They want these companies to be protected. And I guess, look, from a business standpoint, I get that somebody could try to rationalize this. Like, hey, like, you want us to spend billions of dollars producing these vaccines, and then you want us to rush them, and then you also want us to be open for liability in the event that somebody's harmed. Like, hell no, that's a stupid business decision. We're not doing that. Like, okay, I can play that game for a moment, but that also completely ignores the fact that these vaccines are being taxpayer funded, that your tax dollars in the United States and elsewhere around the world, your tax dollars are going into the World Health Organization, or they're going into the Global Vaccine Alliance, both of which are funded by Bill and Melinda Gates Foundation. And then the US is buying these vaccines, and they're saying they're doing it for cheap. But the point is, they're buying the vaccines from the corporations that are profiting off of this while getting taxpayer subsidies from the governments. So they're getting subsidies. These people like the head of Operation Warp Speed, Moncef Slaoui, who was appointed by Donald Trump, they own millions of stock in these companies. So, I mean, there's just so much going on. And look at this, April 2018, Bill Gates talking about indemnification. Way back then, he's like, we need indemnification and manufacturing agreements in place with pharmaceutical companies. This was when he was saying the next epidemic is coming in 2018. And he's talking about then. You go back to 2015, and Bill Gates as well. He says one of these hard questions is, should and can they indemnify whoever is producing the drug to protect them from lawsuits? My point here is that this discussion has been going on for quite some time. You might have just woken up to this, my friends, but they have been thinking about this for quite some time. And, you know, we're basically at the point now where if you question what's going on, if you challenge these systems, you are going to be shamed. You're going to be, outcasted. You're going to be called a science denier. We've just gone over two different studies, one from Yale University, published on the National Library of Medicine, the other from the New England Journal of Medicine. You can find these both on the front page of theconsciousresistance.com under the post, "Here's how they will convince you to take the COVID vaccine." And we can see the strategy. This is coming, guys. This is coming. I'm not a fear monger, okay? I don't like to get all hyped up and act like Alex Jones, like, guys, get ready. But guys, get ready, because the shit's going down. And I don't know when it's going to happen, but I do know that according to the US government, they're saying they're going to have the first 100 million doses of this vaccine in October. This is August 4th, September, October. That's 2 months away. And then they're saying another 100 million doses by December, and then another 100 million doses by January. Maybe that's just a bunch of bullshit. Them saying that just before the election to try to look like they're doing something, but that's what they're talking about. So let's say there's 6 months to a year before this vaccine rolls around. We already see, like the city of Houston where I'm at, $250 citations for not wearing a mask in public. In public now, they're enforcing this. And do you think they would hesitate to do the same thing if you're traveling around without vaccine proof or without, any of this stuff going on? Like, they're going to use this to control you in whatever way they can, because COVID-19 or not, whether this situation happened or not, this has been in the works for some time. It's called technocracy. It's called the technocratic state. I wrote a book and I released it for free in February. It's called How to Opt Out of the Technocratic State. Go visit theconsciousresistance.com, go to the books tab, download the book for free, and swallow it and absorb it and take the information into your mind, please, because it is highly relevant right now. You need to start asking yourself, how can you get food if you don't want to submit to masks? How can you get food if you don't want to submit to vaccine mandates? Do you have your own food? Do you have some supplies? Do you have a community that you're a part of? Have you started a freedom cell? Are you doing anything proactive other than just sitting there shaking in your boots and waiting for them to show up at your house with hazmat suits and cops with guns and put an ankle monitor on you? That's not fake news. That happened already here in Arkansas, in the United States of America. In the United States of America, they've been tracking people's license plate if they're coming from the wrong place, and checkpoints. All these things have happened since February. This is the new normal, and the new normal is leading to the Great Reset. My next video will be focused on the Great Reset. It's going to be a deep dive into the Great Reset. If you haven't read my article about it, go to theconsciousresistance.com, go to The Last American Vagabond, and you can see the article there, COVID-19, the Great Reset, and the new normal. If you want to understand what this is all about and where we're going to, please check this out and educate yourself, guys. Please, 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 please. I don't sit here and ramble and talk for half an hour just to hear my own voice. I do this because this information is important. And as I said in the last video, this information might not be there forever. We're under the threat of being taken down. I don't monetize my channel, so I don't care about getting YouTube and Google money, but I would like to keep broadcasting to you guys via Facebook, YouTube, Float, etc. But they apparently don't want me to be there. So until they delete me, I will be broadcasting, but rest assured, I'm also broadcasting on other platforms that are not deleting my videos, that are not censoring my comments, and that are not taking down my content. If you want to find me, you can find all that information on the front page of theconsciousresistance.com. You can join my Telegram channel. You can sign up for my text list. You can sign up for our newsletter. Please take the time to do this and share this video if you found this content valuable. I appreciate everyone who continues to support my work. If you want to, please contribute to our crowdfunding campaign for our next documentary, The Pyramid of Power. You can find all of that at theconsciousresistance.com. That is it for today, guys. Thank you so much for your support, for listening to my rants, and for seeing that it's up to us to do something. If you care about your family, if you care about the coming generations, if you can get outside of that bubble that is ego and that it is us in this present moment, and think of the future generations and think of what it's going to be like for them to grow up in a world where masks everywhere is normal, where having to get a vaccine just to travel is normal. Think of the people that are coming, and think of how much easier or more difficult life is going to be based on your action or your inaction. And then I think you'll find the answers of what you should do. Thank you guys so much for listening. Until next time, remember, you are powerful, you are beautiful, and you are free, my friends. Peace.